distinguished guests, and all our participants. I'm delighted to be here, and I will be very brief and to the point. Exactly as William said, with my portfolio, in fact, I spent 16 years with a national airline, so I have a particularly interesting perspective on this issue. It's good for me to go through the history and tell you exactly where Seychelles is now. I won't reinforce or countermand anything that's said already, but I will tell you, in Seychelles, we have just two pillars to our economy. One is tourism and one is fishing and the sea. So it was immediately obvious to us that we had to protect our maritime industry. In fact, it was the only one that was going when we closed our borders. And this issue of the seafarers being stranded, it came to a crisis because our public health authority was in charge under the Quarantine Act of Seychelles. And we had to get them out, but the airspace was closed and the matter rose to the issue of the president. And exactly as all of you have said, it was a humanitarian question. When it was raised to our president that these men had been on these ships for 4 months, some 6, some 7 months, not yet a year, the president himself made the call. In Seychelles, we take care of people, this has to go. And so we started our very first flight. In fact, the very first flight we had was a charter flight for the seafarers. And so from the beginning of when we started to open our airspace, we were carrying seafarers. And it worked. I can tell you now, William, and the IMO, I was actually given the task of coming up with the procedures. And luckily, in that same week, you had published your protocols. And what I had done is I consciously designed our process. So what we did was a national facilitation meeting. We had the Port Authority, we had the Civil Aviation Authority, we had the Health Authority, we had the actual seafarer companies themselves, public health officers all together, and we worked through the protocols together and created a procedure that everyone was happy with for the charter flights. And it worked. Everybody was very terrified at the beginning because we didn't know anything about coronavirus. In fact, the public health officers didn't even want to go on the flight. They were so scared. But it quickly became apparent to us that, and as we saw how the virus really operates, that this was working. It was working very safely. The first batch was from Spain, which at that time was at the highest possible, one of the most affected countries in Europe, and France. And it worked. No issues, people came down, went onto their boats, no problem. But then the first problems happened when we started getting seafarers from West Africa, Senegal and Ivory Coast. What had happened there was the company had done a test, sort of a rapid COVID test when they arrived. We had carried about 168 on one flight, 77 tested positive. Mm. And what happened was, it was a political crisis. Just so you know, Donald Trump is not the only person running for presidency. Our president, we have a presidential election this Saturday. And you can imagine the uproar that took place. So we've opened up our economy to seafarers. We told everyone we're following the IMO guidelines. And now suddenly Seychelles, which had had 0 cases, suddenly had 77. And so, yeah, there was a big backlash from the industry, and the doctors were examining the procedures, what went wrong, how did it go, and we started to suspend them again. What it turned out to be, and this is another interesting thing is we found out, is a lot of these young men, they're actually quite healthy. So even though 77 had cases, nobody actually developed any serious symptoms. And we had actually picked up people who were on the other side of the infection. They had the antibodies, but were not actually infectious, but it went on. And so for 2 months, about a month, it was a back and forth. The Public Health Authority did not want to let the crew change happen again because as a small island, we couldn't afford to have that many cases at once. It was going to overwhelm our medical resources. At the same time, we had the humanitarian issue, and we also had the fact that we had to get our economy going. So we came up with procedures to do it again. Only this time now, we had commercial flights, and this added a whole new level of complexity. And I could actually tell you for myself what some of the issues were. Number one, the EU were counting cases in our waters as Seychelles cases. This is a problem. What happened is the EU had a rule that said that anybody that has a certain number of cases per 100,000, you are not allowed to go there as an EU citizen, which is our #1 tourism market. So we actually had a direct conflict between our fishing industry and our tourism industry. If we had another 50 cases, we're suddenly closed off to Europe because the EU was counting those cases in our waters. We went back, we haven't done that. We would love the IMO support that when we have cases aboard a boat and we are transferring through our waters, that this should not be counted the same as a community transmission in a country. That's #1. #2, as an airline guy, I can tell you right now, one of the issues we faced is that seafarers, we had no problem designating them as key workers. The problem is on board an aircraft, they're just another passenger. Now, airline crew are clearly identifiable when they fly on a plane, okay? Seafarers, we know they have seafarer documents, but airlines themselves cannot recognize them. So what you have is you have the seafarers mixed in with the tourists. So the next problem that we've been facing, so what I want to say to you guys is this: charter flights, we follow the protocols, it works perfectly. Commercial flights has been a big challenge for us. And the reason why that is you cannot separate out the seafarers from everybody else. Now, what the doctors have done is they have set a series of rules depending on your country of origin. So we have countries that have low rates of COVID-19. These are called permitted countries, and you can fly in easily on any scheduled flight with certain restrictions, very easy. Then we have another set where the risk is a little bit higher, and we have more restrictions. The problem that we faced with our seafarers is a lot of the actual seafarers were coming from what we call high-risk countries, where they were not allowed into our country if you were a tourist. Now we want to identify them as a key worker on a commercial flight, and we have a total contradiction. So what we've had to do for the doctors to resolve this contradiction is we tell the fishing companies, fly your guys from these high-risk countries to a place like Dubai or somewhere safe, stay there for 14 days, you get blessed by this country, and now you can come in and we're back to where we were before. This has proven to be quite a challenge, but at least we've resolved that. For ourselves, if we could find a way, and I want to add one little twist to this. We have fishermen, and then we have other kinds of seafarers, like the technicians who work on the yachts and people who work on other boats and not as fishermen. I will tell you, we have an easier time with those guys than we do with the fishermen, and I'll tell you exactly what it is. For the yachts, what we've observed is that the seafarers that they bring in are actually controlled by companies that are keeping track and have very strict procedures on what they do and how they isolate themselves and the rules that they follow. So that when they fly in, it doesn't matter if they come from Brazil or Hungary or any other high-risk country, we have confidence that this person is following rules by some organizing company when they come in. And so we're easily able to handle them on a commercial flight. When we talk about the seafarers for fishing companies, we have a much different problem. So say we have 50 seafarers in Ivory Coast. We are not sure if the procedure followed by the fishing company in the Ivory Coast is sufficient in terms of isolation. They'll tell us, oh yeah, they're in a hotel on different floors, but then we hear that they're mixing in between, and so the doctors get concerned that in fact, they're actually potentially spreading COVID-19 amongst themselves. So if the seafarer companies, if the fishing companies can assure us as a country that whether you're coming from a high-risk country or anywhere else, we know that your seafarers are following strict rules of some kind, whether you have security guards, whether you have somebody who's monitoring them on their way, then this also makes it very easy for us, because then you become like the cabin crew, the flight crew, or anybody else that follows a strict set of procedures, if that makes sense. So the IMO protocols are perfect. What we need on top of that when it comes to scheduled flights is a form of assurance, particularly for those seafarers coming from high-risk countries, that they are being isolated and that we can accept them. And then we found it very easy. So on the ground, we've found a way to do it. And to show you the importance of what we've done, I've just checked the statistics. 10% of all of our flights are seafarers. All right, so it's actually a huge proportion. And in fact, in the first month, it was more like 40, 50% as tourism was increasing. And I think with those very practical changes, and with the knowledge that coronavirus is now a very manageable disease, we know a lot more about it than we did before, so that especially with these young strapping men, they're in that demographic where, to be honest, it's not as much of a risk to the country. And this is not a theory, this is what we've actually observed. We've seen a lot of cases and no serious cases. So that's also helped reassure us. So from our perspective as Seychelles, as a value system, we will continue the seafaring. It's sputtered at first, it's now roaring, and it's very important. And it was always a humanitarian issue. This is what we do. This is what we will continue to do. And I'm delighted to have been a part of that. And the IMO procedures are perfect. But in the context of scheduled flights, to me, I think if we can get the IQ and the airlines to help recognize seafarers, and we can get those companies to assist with those isolations, it'll make it very easy, give the assurances that the public health authorities need. And with that, I think we can make a lot of progress. To address my friend in Mauritius, it's the fear factor that was the biggest problem at first. But the more you know, the more you learn.